Hello, everyone. Okay, so we'll be starting in a few minutes. We're waiting for, we'll be starting in a few minutes, in about 6 minutes. No, 3 minutes. 3 minutes. Okay, we'll be starting in 3 minutes at 10:43. Please bear with me. Sorry, I kind of lost my voice, so my voice is a little deeper than usual, but that's okay. So while we're waiting for others to join, please share the video, and make sure more people join. Share on every platform as much as possible. Okay. We are going to start in 1 minute while we wait on others to join. So please continue to share the video so we can get more people to watch and learn. Okay, we'll be starting in a little bit. Bear with me, everyone. I want to start when at least more people have joined because I don't want people to miss some information. We're running a little bit late, but I promise you we won't take much of your time today. Thank you. Thank you for coming. Thank you for joining. We are starting in one. Okay, so we are going to start. We are going to start, and today our topic will be bacterial vaginosis. This is strictly a women issue. Why? Because men do not have vaginas. Only women have vaginas. So this is strictly a women issue, but men can still watch and listen to this video because they can be of help to their mothers, to their sisters, to their friends, to their wives, to their girlfriends. So please, everybody needs to watch this video. Everybody needs to listen to this information. Pardon me, I lost my voice, so it's kind of deeper than usual. Okay, it's kind of deeper than normal. So today we are going to talk about bacterial vaginosis. Bacterial vaginosis is when there's overgrowth of bacteria in the female reproductive organ, specifically the vaginal area. So when there's overgrowth of bacteria, then of course you will start having issues. The woman will start having issues down there. And usually there's the vagina, just like the skin or your nose, they all have normal bacteria that grow, or in your gut, they all have, these body parts have normal flora, normal bacteria that stay in these areas. They stay in these areas and protect the areas from infection, from damage, or from, trauma. So when this bacteria, when this normal flora is being altered, when the bacteria is around these areas are being altered or maybe displaced or killed, then there is bound to be a problem. Okay. For example, we have bacteria in our gut, in our stomach. When this bacteria get killed, maybe by something, maybe excess antibiotic or some issue, then then that you start your stomach, you will start having stomach problems. You may have diarrhea, constipation, or whatever that problem may cause. So please stay tuned for this information. Okay, so we've talked about, I've just defined what bacterial vaginosis is. It's when the normal flora of the vagina is being altered. The normal flora of the vagina is being altered, like the bacteria that are in the vagina are being altered. Then you start having all these complications. And bacterial vaginosis is a kind of vaginitis, which is like an inflammation of the vagina. Okay, so we have talked about that. So the next thing we're going to talk about is the risk factors. When I say risk factors, I'm talking about the things that will put you in the position of having bacterial vaginosis. That's what I'm talking about. I'm talking about maybe your environment or your body or your something you're doing, your personal hygiene and all that. That's what I'm talking about. Your risk factors, the things that will put you at stake of becoming infected or at stake of having bacterial vaginosis. They put you at risk. So risk factors will include things such as douching. I don't know if you're watching me and you've ever douched or you've not douched, or you've heard of douching, or you've heard someone say they have douched, something like that. They have done, What is douching? Douching is when you put water, hopefully it's clean, sterile water. You put it in a bottle that has like a little tip and you squirt it into your vagina. That's douching. That's practice. A lot of people do that because they think maybe they want to clean their vagina, or maybe they want to get rid of, maybe after sexual intercourse and all that. When you do that, it alters the flora, it alters the bacteria. You're washing the bacteria that are supposed to be in your vagina. You're washing them away, and that puts you in a position where if you come in contact with any bacteria or any organism that can cause illness, you will be at risk of getting that illness. And when you wash out all of your bacteria, there's nothing else to protect that area. There's nothing else to keep that area normal, keep it normal. Therefore, you start having the itching or other symptoms that are associated with bacterial vaginosis and vaginitis and all that. So that's the issue. That's the issue when you douche. So please, women, douching is not a good practice. Douching is not a good practice. Except your doctor or your primary care physician or your nurse practitioner like me prescribe it for you. Do not do it. Like I have said in other instances, do not put anything in your vagina that is not supposed to go in there. Do not put anything in your vagina that is not supposed to go in there. When I say do not put any, I've heard of people putting garlic to cleanse or to fight infection and all that. That's not a good practice. People have said it helps them, but that's still not a good practice, because you can, and I think I end up in your fallopian tube or somewhere that is not supposed to be. What are you going to do? Now you're going to go to the hospital and pay more money to get the garlic out. Meanwhile, you would have just gone to the doctor and say, hey, doctor, I'm having this vagina itching. Please prescribe something. So do not put anything in your vagina that is not supposed to be there. Do not douche. Do not douche, except it's medically prescribed or stated by your doctor. Okay, what's supposed to go in there? It's, what's supposed to go in there. Vagina is meant for sex, yeah, and other things. Okay, so please do not douche. Do not put anything in your vagina that is not supposed to be there. Another thing is excess or poor hygiene. Some of us women, we are on our period and we have one part on from morning till night. That's not good. That's not good, because that is poor hygiene. Of course, you're supposed to change your pads. You're supposed to change your pad as often as possible. I'm not saying you should be changing every 30 minutes, except you're heavily bleeding, but at least, change your pad when you use the bathroom, number two inch, when you pass 2, when you have a bowel movement, you need to at least change your pad, change your pad and all that. And then the kind of products we use, you want to wash yourself, you spray perfume down there, you spray all kinds of things, you use all kinds of soap to keep it clean, smelling nice, but you do not know, you forget that you're killing the bacteria, you're killing the organisms that are supposed to be living there to protect you. You're killing these organisms. So when you do this, that's when you put yourself in the position of getting sick. Okay, getting sick, I mean like getting infections, the bacteria and the lactobacilli and all that are supposed to be there to protect you. Now you have cleaned them, you've excessively washed them away with soap or with other products, and now there's nothing left to protect you. So whatever thing passes down there, you get infected. So one of those things that can excessive hygiene or poor hygiene can lead to is vaginosis. You're not washing your private part, you're not washing your vagina area, you're not washing it, you're not keeping it clean. That's a problem as a woman. It can cause excessive growth of this bacteria or destruction of this bacteria, and then it will cause excessive growth of the bad bacteria, the infectious ones. Then that's when you start having all the issues and even more. And this is not good for you, because when you have these complications, it can lead to more complications and more serious complications. You get it? It's a chain reaction. It's a chain. And then another thing is when you change your feminine product, of course, sometimes when you change your feminine product, you can start feeling something different down there. If you change into a product and you feel like it's uncomfortable, please do not use that product anymore, because that can be destructive and dangerous to your health. Okay, the next thing we're going to talk about is people who are already sick, people who are diabetic. Sometimes they are risk for infections. So if they're not careful, that's why diabetics, people who have diabetes should constantly see a doctor, because they are at risk for so many infections. Again, of course, women of African descent, we are at risk for such. I don't know why, but statistics have shown that we are. I forgot, I would have brought a douching bottle to show everybody what it looks like. So douching bottle, you put, when you have a squeeze bottle. If you work in a hospital, there's a bottle with water in it. It has a long tip that you insert into your vagina, and you squeeze the water into your vagina. When you squeeze it, it goes up into your vagina and comes back out. That's douching. You put you have to insert it. Douching is not douching does not mean you just sit there and no, you have to insert it into your vagina, and you squeeze the bottle for the bottle to wash the inside part of your vagina. Tomorrow I'll make sure I bring a douche bottle and demonstrate and show everybody what it looks like. So if you see it, or if somebody is saying they want to douche, please tell them not to, because it's not a good practice. Okay, and then the next thing is oral contraceptive. For some reason, women who are on oral contraceptives, when I say oral contraceptives, those are these pills that you take to not be pregnant. These are the pills that you take to keep you from getting pregnant. What the oral contraceptive does is it alters your hormonal balance. It alters your hormones. It prevents you from having the hormones that will provoke pregnancy, right? Prevents you from having the hormones that will provoke pregnancy. And as a woman, when these hormones are decreased, when your hormones are altered, for some reason, it alters your normal flora in your body, and that keeps you open to having all this vaginal infection. When you do these things, like sometimes like douching, it alters the pH of the vagina. It alters the acidity of the vagina. The vagina is supposed to be the acidic level of the vagina is supposed to be at a certain number. Sorry, I can't remember for right now, but it's supposed to be at a certain number. And if it's too high, it means there's a problem. And if it's too low, there's a problem. So it has to be in a certain level, just as your body temperature. If your body is your body temperature is 90, of course, that's a problem. 90 degrees Fahrenheit, that's a problem. If your body temperature is 35 degrees Celsius, that's a problem. If it's 40, that's another problem. So it has to be 37 degrees Celsius, right? That's normal body temperature. Same thing as your vagina. It has its pH, it has its temperature. Anything that will alter the temperature or the pH level or the acidic level of the vagina has a problem, that will cause a problem. You put this patient or this person at risk for getting vaginal infections that they are not supposed to get. So please, your vagina is very important. It's very important. That's where you're going to be able to make your babies. That's where you're going to be able to, reproduce. So please do not mess with it, because if you mess with it, then you're having troubles. And when you keep having these infections down there, your partner is going to be afraid of you. It's going to be scared of you. Like, what's wrong with this woman? Does she? And they start thinking maybe you have maybe you have a super bug infection. Meanwhile, it's just something simple you're doing that is wrong. Okay. And then IUDs, women who have IUDs in, of course, it alters the normal flora of the vagina. So that's why you have to go every time for the doctor to check it. And the normal flora, you have to go to the doctor to check it and make sure everything is good. Because if you have an IUD in and you don't go to the doctor in like 3 years or 4 years and you just leave it there, believe me, something can happen and you will not even know. Something even worse than bacterial vaginosis can happen and you not even know that you're having this problem. And then when it's time to have children, they say you cannot have children. You say, oh, it's my grandmother. Oh, it's my stepmother. Oh, it's my mother-in-law. Oh, it's my sister-in-law. No, it's you. It's because of the things you've been putting in your vagina that's not supposed to be there. So please refrain from putting things in your vagina that you're not supposed to put. Refrain from. I mean, if you have an IUD, of course, that's an intrauterine device to keep you from getting pregnant. A lot of women have IUDs. If you have one, make sure you go to the doctor every time you're supposed to go to check it, to make sure it is in place, to make sure it's not, because sometimes you can have it there, and I've seen people who go in and the IUD has been displaced and it's in the wrong place, and that's causing them a lot of issues like bacterial vaginosis, of course, and all that. And they don't even know what's causing the problem. They keep treating the infection, and then one day they realize, oh, it's the IUD I have in. I mean, it's a small percentage of people who have come up with this problem, but it's, of course, it's possible that things like this can happen. So please take care of yourself. And then the next thing we're going to talk about, for some reason, women of reproductive age usually have this bacterial vaginosis. Why? Because sometimes women of reproductive age are the ones who are more sexually active. They have multiple sexual partners, and this is one reason why women will have this problem. When you have a new partner, or when you have multiple sexual partner, you are at risk for so many things, and that is a very dangerous thing. A man can have multiple sexual partner. And they will not be as exposed as a woman, because of course the man has a closed system while a woman has an open system. Our vaginas are just there like that. If you just take anything and put, it will go through. Anything you put, it will go through. So women, you have to be careful, because when you have these sexual partners, of course, your vagina, like I said, has the bacteria that it's supposed to have. Sexual partner has his own bacteria on the skin, and you probably do not know what kind of bacteria they have. So when they come in contact with you through sexual intercourse, then they deposit their own bacteria from their own private part to you, and that may cause issues. That may cause you realize that maybe you have a sexual partner, the next minute you get up, you start having itching all over, little complaints here and there because of a new sexual partner. Maybe after 1 week, you realize a change in your vagina, and all that, because of the sexual partner that you've just had, or because of the multiple sexual partners that you've had. At least if you have one partner, maybe when that happens, you'll be able to say, oh, it's probably because I slept with Jay. But if you have like 2, 3, 4, multiple, how will you know who is causing what? And you never know. Sometimes even this bacterial vaginosis is a smaller problem. Maybe the sexual partner has HIV, they have gonorrhea, they have syphilis, they have chlamydia. Maybe, so you have to be very careful. As a woman, you have to be very careful how many people you're sleeping with and who you're sleeping with. Keep track of the people you're messing around with or sleeping with, because like I said, people have things they're carrying on their bodies, on their systems, we do not even know about. And as a woman, when they deposit these things to you, sometimes it'll be very difficult for you to get rid of. And then you go around and pass it to the next person. And that's how we have the chain, the circle. Everybody in the neighborhood is infected with a certain disease, and we don't know who brought it. We don't know where it's going to. We just know that everybody has it. That's why you see, they'll say in a community, 100 people have this disease. How did they come about it? Because somebody brought it and gave it to them. Just like COVID now, that people are breathing it out. Some of these things are going around and we don't know, you might not be aware of how you got it, but then definitely you'll be the one spreading it. So we have to be careful. And then bacteria will quadruple, exactly, due to multiple sexual partners. And then we're going to talk about the signs and symptoms of bacterial vaginosis. Bacterial vaginosis is not yeast infection. It's not yeast infection. Yeast infection is a fungal infection. It's caused by a fungi. But bacterial vaginosis is caused by a bacteria. So one thing I'll tell you, even if your vagina is itching, of course, women, you know what I'm talking about. Or if you're having this discharge and you go and take antifungal medication like nystatin, it's not going to help you in any way. I mean, it's gonna probably you kill some fungal infection if you have any fungi in your system, but it will not kill the bacteria. It will not cure the problem. So please, if you're having any of these symptoms that I'm going to mention, I'm not going to say it's bacterial vaginosis specific, like solely, because again, like I said, a lot of diseases have similar symptoms. A lot of diseases have similar symptoms. So if you're having this discharge as a woman, if you're having this thin, white, smelly discharge, it's called malodorous discharge. If you're having that, it means it's probably bacterial vaginosis. Number one, check if you've been douching. Check if you've had a new partner. Check if you've had multiple partners. Check if you've changed your vagina soap or hygiene product. Check if you've been cleaning down there as much as you're supposed to. Check if you've been doing it excessively, like minute. You're in the bathroom washing. Every second you're in the bathroom washing your vagina, washing. You're obsessed, and that will cause excess, that's excess hygiene. So if you're having a thin, white discharge, malodorous discharge, then think about all these things I have said. Maybe it could be one of these things I have said that is causing the problem. And again, you have to go and see a doctor. You have to find somebody who has an expertise in treating this infection, this bacterial vaginosis, so they can treat it. Okay, so the hallmark sign, or the main the characteristic symptom, of bacterial vaginosis is this thin, white, malodorous discharge. A lot of women, in fact, every woman, it's very possible that you might have had this in one at one point in time in your life. It's very possible. So if you've ever had it, there's a possibility that you might have it again for some reason. So please, if you are having this malodorous discharge, it's very important that you see a doctor, because like I said, it could be bacterial vaginosis and it could be anything else, because a lot of things will manifest in similar ways. It could be maybe you have had somebody with recent HIV infection, or maybe chlamydia, gonorrhea. It could be anything else. So, but I'm just saying, it could be bacterial vaginosis. When you go get the treatment for bacterial vaginosis and it doesn't work, then that's when your doctor will say, maybe let's try another thing, let's do another test and all that. But the doctor will definitely perform a test. They'll collect a sample from your vagina and do a test, and then they'll see the bacteria that is growing in it, and then they'll be able to treat it. Okay, they're able to treat it appropriately. Another risk factor that I'm going to tell you before that slipped off my mind: antibiotic use. Some of us, we have antibiotic in our house, we have it in the kitchen, we have it in the bathroom. If we have a headache, we take antibiotics. Our toe is hurting, we take antibiotics. No, that's not how you take antibiotics, because what will happen if you take antibiotics the wrong way, or you take the wrong antibiotics, you develop resistance. If you take the wrong medication for the wrong illness, you might develop a resistance to that antibiotic. So next time when you have a disease that is requiring you to use that particular antibiotic to treat it, it will not work for you. It will not work for you. For example, let's say amoxicillin. Amoxicillin treats a lot of illnesses, right? Okay, this is an example. Amoxicillin will treat, maybe they'll give you for ear infection. You have an ear infection, they'll give you amoxicillin, you take it. Now, if you have another infection on your toe that does not need to be treated with amoxicillin, and you take amoxicillin, there's a high chance that you develop a resistance. And that infection, and if you develop a resistance to amoxicillin, right, when next you have an ear infection, they'll give you amoxicillin. That amoxicillin will not work for you because you've developed a resistance. You've used it in the wrong way. That's one thing. And then antibiotics will distort the normal flora of your gut and your vagina. So when they distort that, they distort the normal flora, the mucous membrane and all that. When they distort the normal flora of your vagina, guess what? You'll be prone to this infection, because now the bacteria that is supposed to be in your vagina to protect you from getting infection, from having this bacterial vaginosis, is destroyed. Now your vagina is right there, and the bad bacteria and all this inflammation, infection, all these things will start happening to you, and you'll be having all this itching and, discharge, uncomfortable discharge. So please do not take antibiotics like that except it's being prescribed by a doctor or by somebody who really knows what you're sick of and what you need. Okay. So I've talked about signs and symptoms. So like I said, if you're having any signs and symptoms, any discharge or anything, it's always advisable to see a doctor. If you cannot see a doctor, you can always, find somebody, like text me, contact me and say, hey, this is what is going on. And I can assist with, I can refer you to somebody who will be able to treat you if you're in Cameroon or in the US. Okay. All right. And then, but this bacterial vaginosis is treated with a medication called metronidazole. That's like the first line medication that the doctors will give you. It's called metronidazole. It's called metronidazole. And when you take this medication, the doctor will tell you, do not take alcohol. Why? Because if you take alcohol with metronidazole, you will have unpleasant side effects like headaches, confusion. You will develop, you develop muscle cramps, nausea, vomiting, and that will be very awful, because now we'll have to treat these symptoms. We'll have to treat the other issues that you've developed. So please, if you go to the hospital and your doctor gives you any kind of medication, do not take any medication with alcohol, period. Because when you do that, it will cause a lot of side effects, and it will expedite a damage to your liver. Okay, so do not take any medications with alcohol. All right. And then they can give you other medications like clindamycin, and whatever the doctor decides to treat that infection with. Okay. So I have said, if you start having itching and it's uncomfortable, you have to go and see a doctor, especially if you've had a new sexual partner, because like I said, it could be something else. It could be something, maybe an STD or an STI, or maybe a worse problem going on. So if you start having any uncomfortable discomfort, uncomfortable discharge, or odor, itching, or anything like that, it's always important to go and see a doctor. Okay. And then there are complications. If you don't treat this bacterial vaginosis, there are complications that may arise. Another one of them is pelvic inflammatory disease. I have talked about pelvic inflammatory disease before. It only affects women. It affects your pelvis, your pelvic area. And this is, like, for women, is very important, because your uterus, your fallopian tubes, and all the other parts that men do not have down there can be destroyed. And when you have this PID and you don't get it treated, it can lead to infertility, preterm labor, complications. So please, if you have this bacterial vaginosis, or you know anyone who has bacterial vaginosis, it's important to go and see a doctor to get it treated. And then, like I said, another complication of bacterial vaginosis is the fact that it exposes you to other infections. Because once that bacteria is, when the normal flora is destroyed, remember I said in the beginning, the vagina has normal flora, normal bacteria that are there to prevent you from having diseases, to keep you protected. So once this normal flora is destroyed, anything can happen. Anything. It's like you have a fence. The bacteria in the vagina act like a fence, right? This is the fence right here. And once this fence is destroyed, just this one, if your fence is supposed to be like this, and it's this portion is destroyed, anything can go through that area. And then imagine if all of the bacteria in the vagina is destroyed. If all of the bacteria in the vagina are destroyed, anything can go in, and so simple infection like this can lead to a very severe complication. So please, ladies and gentlemen, men who are watching me, if you have your wife or your brother, your sister or your brother's wife, or your girlfriend, your mom, please always tell them about this, what I have said, because it is very important for us to be safe and for us to live happily, because living is not only about looking good, it's also feeling good and feeling healthy. You have to keep yourself safe, sound, and healthy. So if you have any questions or any concerns, anything, please let me know. You can text me, you can contact me on Facebook, you can contact me on regular text messages, call me. You can also write me on WhatsApp. For some reason, I reply WhatsApp messages faster than I reply regular text messages. So you can always contact me. If you have any questions, any concerns, any suggestions, please contact me. Feel free. Facebook name, Mami Abi. And thank you for coming. Thank you for watching. Stay tuned for more opportunities to learn. And if you have any suggestions, please, I am open and I am ready to learn. Okay. Ask me. What's your question? So I guess now it's going to be question and answer session, because somebody has a question. I'm listening, or I'm waiting for the question. Okay, so like I said, you can drop your comments, drop your questions under the video. If you do not have any questions, we have 3 more minutes and we are done with this session. So I'll just be waiting for your questions for the next 2 to 3 minutes, and then we are done. And I think okay, somebody just sent me a message that she cannot see where to comment on YouTube. If you cannot see where to comment, you have to have a YouTube channel, I guess. I am a YouTube page before you can, or a YouTube account before you'll be able to comment under my video. I think so. Exactly. You need regular checkup. Exactly. Fine, especially those of us in the United States. They are like low-income clinics. I think I know a nurse practitioner who take like $35, and it's just once a year at least. Just go to see a doctor at least once a year so they can do regular checkup, and every 3 years or 5 years you have to do a pap smear. And then if you have itching and all that, yes, you need to see a doctor. Because why? If you go get over-the-counter medications, usually maybe you're treating the wrong thing. Maybe you'll be treating the wrong thing. Do not self-treat. I do not encourage people self-treating themselves. I do not encourage that. Why? Because like I have said in several videos, different diseases have similar symptoms. So you can think you have a headache and you're just treating a headache. Meanwhile, there's a more severe problem to that. It could be a stroke that is about to happen. It could be high blood pressure. It could be a brain tumor. It could be anything. So, I mean, if you have a headache that is consistent, that keeps coming on and off, then it means there's a problem. You don't have to keep taking Tylenol for it. You have to go and see a doctor. And then if you're a woman, if you keep having this vaginal itching, especially repeatedly, it means there's a problem. There's a problem. Yeah, I mean, I recommend that people keep their vagina clean. Okay, some people have said they just trim their vagina area and it works for them like that. They've never gotten any infection. For others, they have to clean everything to make sure it looks like a baby skin before they can be free from all this infection. So I say no, it's good to know yourself. Whichever one you have tried that hasn't worked for you, then that's the wrong one. But usually I recommend that you clean as much as you can. You can use a razor. You can use a razor to clean that. What is the normal pH? I think it's about 5. Just give me a second. Because normal pH is supposed to be 3.8 and 4.5. That should be the normal pH of a vagina, of a woman's vagina. So yes, so anything above that is a problem, and anything below that is also a problem. So, okay. Any more questions? We're about to close the session for today, and we'll be back tomorrow. Okay, so I think there's some. Okay, somebody has a question. They're typing. Okay. Okay, so you cannot check your pH by yourself. I don't know how you do it at home. You have to go to the doctor. They check it for you. When you go to see your primary care physician, you can just ask them out of curiosity. You want to know what your vagina, especially if they do like a pap smear or a pelvic exam. You can ask them. They'll tell you. When they get the results, they'll be able to tell you. Make sure you ask them before they send the tests to the laboratory, so they remember to call you and tell you what your lab results are. Okay. So somebody said they have a question, but it seems as if they're still typing. Okay, so thank you all for watching, and thank you for listening, and thank you for asking your questions. Or somebody said they had a question, but it looks like they're still typing, so I'll probably answer that offline. Thank you so much for coming. Thank you for listening. Stay tuned, and we have more videos coming. We have more interesting topics and more interesting information to learn from. Again, if you have any questions, if you have suggestions of what I can do to improve, or if you have suggestions of any diseases you want me to talk about, please feel free to send me a message or comment under my video. I'm open to feedback and criticism. Please text me. Anyhow you want to do it, I'm still open. Again, thank you for coming, and see you next time. Bye.